Baptist Hospital was incorporated as Protestant Hospital on December 12, 1918, and opened its doors to the community in the midst of a flu epidemic on March 20, 1919. The founders bought property with existing buildings so that no time would be wasted in getting the hospital operational. The property was referred to as the Murphy Home Place and was bounded by 4 city streets: Church Street on the south, 20th Avenue on the east, 21st Avenue on the west, and Patterson Street on the north. There were 10.5 acres for future hospital expansion. The new hospital had 80 beds and a fully equipped surgical department. A school of nursing was also established in 1919 and was one of Protestant Hospital's most successful enterprises. Entrance requirements included having an 8th grade education and being at least 16 years old. Only women could attend, and they had to furnish their own thermometers, prep trays, and scissors. Protestant's first patient arrived on opening day. Gladys Kilby gave birth to a baby girl, Anita. That birth may have been an indication of what was to come in the next 90 years. This was the place to have a baby. Mother and daughter were discharged 13 days later.
There will be no effort to operate the hospital for profit.
That was the statement quoted in a 1919 newspaper article on the hospital's opening, and the hospital has remained one of the largest not-for-profit hospitals in the region. Protestant Hospital was so full the first year that people had to be turned away, especially when a second influenza epidemic struck. Nevertheless, the hospital was plagued by debt. In 1932, the hospital went into receivership. Still, the hospital continued its operation due to the determined administration and employees that kept the hospital alive. But financial woes were unrelenting. By 1948, the hospital was headed for bankruptcy. Reverend Dr. James Sullivan had wanted to create a Baptist hospital in Nashville. So Dr. Sullivan, along with Jack Massey, a local businessman, worked to find a way for the Tennessee Baptist Convention to buy the hospital. They gathered a group of men who agreed to shoulder the financial load, and Protestant Hospital was rescued from the brink of bankruptcy. Protestant then became Mid-State Baptist Hospital.
The hospital is to be run in a religious way, highly ethical. It is also to serve all races, all people, and regardless of their cultural backgrounds and religious differences.
That was the philosophy of Sullivan and the new Baptist Board. They began to make many positive changes, renovating and re-equipping the existing buildings. Mid-State Baptist Hospital was renamed simply Baptist Hospital in 1964. Jack Massey would serve as chair of the board until 1960 and would continue to be a special friend of Baptist Hospital throughout his life. Many prominent Baptist men would serve on the board during its history, culminating with Virgil Moore, chair of the executive committee, until the coming together of Baptist and St. Thomas hospitals. In 2002, Baptist Hospital joined St. Thomas Health Services Regional Health System and became a member of Ascension Health, a Catholic organization that is the largest not-for-profit health system in the United States. Throughout the years, the hospital's administrators, including Gene Kidd, David Stringfield, Erie Chapman, and Bernie Sherry, have brought the talents and gifts that were needed for the hospital's growth. The first chief of the Mid-State Baptist medical staff was Dr. Charles Trabue, and over the years the leadership, dedication, and expertise provided by the medical staff has been vital to the hospital's survival and success. Our nurses today continue to be the core strength of our ministry. While the Baptist School of Nursing closed in 1970, as hospital nursing programs diminished and were replaced by emerging degree programs at universities, many nurses obtained their training here. From the time the school opened in 1919 until it closed, there were 1,038 graduates. Over the years, many celebrities and sports figures have supported, delivered their babies, and received health care at Baptist Hospital. Celebrities including Elvis Presley, Garth Brooks, the Mandrell Sisters, Vince Gill, and Johnny and June Cash. Several sports figures have lent their name to Baptist, including Roger Staubach, Tom Landry, Olympian Jackie Joyner-Kersee, and Tennessee Titans head coach Jeff Fisher. Today, St. Thomas Health Services is the official healthcare provider to the NFL Tennessee Titans. Baptist is one of the leading hospitals in the state, and the list of accomplishments and firsts at Baptist is long. In 1964, the first coronary care unit in the region was established. The first nuclear-powered pacemaker was installed in a patient in 1973. Baptist orthopedic physicians were pioneers in joint replacement, performing the first total hip replacement in the region in 1969. The Special Care Nursery opened in 1976, caring for the tiniest and sickest of babies. Baptist was also home to the first lithotripter suite in the region in 1985. In 1990, the first hospital-based dedicated laser and laparoscopic surgical suite was dedicated. The first comprehensive women's center in the region was established in 1991. In 1997, the first chest pain center in Middle Tennessee was established at Baptist. The Comprehensive Surgery Center was renovated in 2005, as was the Joint Replacement Center. A new Serenity Garden was created for our associates, patients, and guests in 2007. And in 2008, the Virgil and Nancy Moore Family Chapel and Reverend Charlie M. Curb Sanctuary opened, as did a renovated endovascular suite. The Neonatal Intensive Care Unit was renovated and expanded to 52 beds in 2009 and named the Beeman Neonatal Intensive Care Unit. But it is not buildings and technology that have made Baptist the trusted healthcare ministry it is today. It is the associates and caregivers. Over the years, they have not only provided the best in care for patients and their families, they have reached out and given back to the community in a big way, providing community education, screenings, and financial support. Thousands of people have been trained in CPR through the hospital's CPR Saturday program. The hospital provides a variety of childbirth classes, joint replacement seminars, and diabetes support classes. Over the years and continuing today, Baptist Associates contributed to the community by participating in fundraisers for everything from the Heart Walk and March of Dimes to Habitat for Humanity. On Baptist Hospital's 90th anniversary, our associates know they stand on the strong shoulders of those who came before them, and that they will represent the heart and soul of our healing ministry as we enter our next 90 years.